So good morning. My name is Diane Layton, and I'm the project manager for the BC Stroke Strategy, and it's my privilege to welcome you here today to our second TeleLearning series called Understanding and Management of TIAs in BC. We have quite a number of sites, about 16 sites that were registered to sign in. So I'm just going to go down the roll call here to confirm that you are here. We're based in the Victoria General Hospital in Victoria. The next person that I have on the list, if they could just unmute their phone or their microphone and indicate if you're okay and you're connected and the number of people on your site. So I'll quickly go through the roll call here. I've got Abbotsford Regional Hospital.
Hi, this is Abbotsford here. We're not connected, and I'm on the phone.
Okay, I'm going to ask you then to mute and hang in there and see if you can get the connection.
Okay, you want me to mute the microphone?
Yes, please.
Okay, yeah, done.
Next site is Royal Columbian. Is there anybody there? Unmute your phone, please, at Royal Columbian. I guess we have got no one at the Columbian. The last site here is Chilliwack. Anybody from Chilliwack? Unmute your phones, please. Okay, moving into the interior, is there anyone at Cranbrook East Kootenay Regional Hospital?
Yep, there's one here.
Thank you. How about at Kamloops Royal Inland Hospital? How about at the Ethel Street Administration Building in Kelowna?
In Kelowna, yeah, one here.
How many of you there?
Just one.
Just one. And Kelowna at the Kirchner Plaza?
Yes, there's two of us here.
Thank you. Lillooet Health Center?
Hello, yes. 3 attending.
Oh, great. Now I'm in Trail at the Kootenay Boundary Regional Hospital.
Yes, one here.
And up to the Northern Health Authority at Euston Health Center?
Yes, 4 of us attending.
Oh, nice. And also in Smithers, Buckley Lodge.
Yes, there's 4 of us attending.
Great. Now we're in the Provincial Health Services Authority. We're looking at the Surrey site. Is there anyone at the Surrey site?
Can you hear us? There's 6 of us here at Surrey.
6 at Surrey, and I know we have Richmond. How many are in Richmond?
We've got 4 in Richmond.
Thank you. Anyone at Vancouver General Hospital?
Hi, Diane. Yes, we've got 6 in attendance here.
Thank you. How about Nanaimo Regional Hospital?
Hello, we're here, and we have 5.
5. And there's a UBC room at Nanaimo General. Is there anybody in there? Maybe not. Saanich Penn, anybody there? In Victoria?
4. There's
4
of us here.
Great. And at Royal Jubilee Hospital in Victoria?
Yeah, Royal Jubilee is 4.
4. Great. Well, welcome all of you, and I won't spend any more administrative time with you. We are going to do this in lecture mode, so it'll be just primarily Dr. Penn and his slides that you'll see, rather than flipping back and forth. If you could put your microphones on mute, except when we get to the question period, and then what I'm going to do is just use the roll call as a means to go around the province to see if there are questions or comments on Dr. Penn's presentation. Is there anyone just on audio today?
Hi, Dan.
Okay.
Mark.
Pardon me?
Mark.
Hi, Mark. Mark Collison is on audio. Thank you. Okay, well, we're going to go ahead and get going. I wanted to introduce Dr. Andrew Penn, and it's a privilege to do so. Andrew completed degrees in neurophysiology and medicine at Cambridge University in England, and then did specialty training in neurology at UBC. He did an MRC fellowship and MR spectroscopy of the brain and muscle and went on to become an associate professor in the departments of neurology and public health sciences at the University of Alberta. In 1999, Dr. Penn helped establish the Stroke Rapid Assessment Unit and the Centre for Stroke Research in Victoria. He presently holds a Heart and Stroke Foundation CIHR grant examining TIA incidence and intervention on Vancouver Island. Welcome, Dr. Penn, and thank you for being our second speaker.
Thank you. Well, it's exciting to have this large group of people around the province and from very different and in different settings. So I'll hopefully have something which is relevant to the different locales that you're practicing in. We're a little behind, so I'll have to try and race to a certain extent. This is a slide which I always start with because it sets the tone for the whole story. What we're going to be talking about is TIA. And in 2000, that recently, just 9 years ago, a paper came out which showed the prospects for somebody who'd had a TIA. And what this curve shows is that after an initial TIA, your chances of having a stroke are really quite high. 10% of people will have a stroke within 90 days, and half of them will stroke out within 48 hours. So after a TIA, 5% will have a stroke within 48 hours. That was in 2000. Even more recently, excuse me, a paper from the Oxford group looked at the incidence of new events in their community, and this was an opportunity to measure everything that happened in a community of general practitioners around Oxford, in Oxfordshire in England. And they looked at all of the strokes and acute coronary syndromes and peripheral vascular disease events, and they were able to show to, I think everyone's surprised, that there was a lot more cerebrovascular events going on than cardiovascular. In this curve, you'll see the top one, the yellow one, are the non-fatal strokes, whereas the green one are the non-fatal myocardial infarctions, and the purple are the peripheral vascular events. And there are other graphs which show similar distribution with other designations of these diseases. But the story here, or the message here, is there's a lot of cerebrovascular events going on in the community. So number one, it's dangerous, and number two, there's a lot of it.